Now, it's commonly thought that the rise of social media has increased problems with mental health, but a new study challenges that. The research done by the Oxford Internet Institute looked at the rise of Facebook and how well-being was affected in 72 countries. Here's our technology editor, Zoe Kleinman.
If you're one of Facebook's 3 billion global users and you've sat scrolling through your timeline on the social media app, you may have found yourself wondering whether it's doing you any good. You're not alone. Now researchers at Oxford have tried to quantify its effect globally. In the largest study of its kind, Facebook gave researchers 12 years of data showing how much it had grown across more than 70 countries and comparing that to surveys on how well-being has changed in those countries. The big and possibly surprising conclusion: there's no evidence Facebook's growth is linked to widespread psychological harm. Quite the opposite, in fact.
There didn't look like there was a negative connection between countries becoming kind of more saturated with Facebook and negative impacts, negative associations with well-being and mental health. We found some evidence actually of the opposite, that as countries kind of adopted Facebook to greater degrees, levels of well-being were marginally higher.
But the team themselves have likened this to research at 30,000 feet. So, a word of caution. Some experts argue the findings are too broad-brush to be useful, as it wouldn't have revealed whether smaller groups of vulnerable people experienced harm or factored in whether some types of content were more harmful than others. It also looks at only one social network, Facebook. There's been an explosion of other social media sites over the past decade, and it doesn't include those. What everybody agrees on is that more research is needed. The report authors say that more tech companies should open up their data to independent research so we can find out once and for all how our use of social media really affects our mental health.